You have noticed it. Maybe it appeared gradually, so slowly you barely registered it happening. Maybe it seemed to arrive almost overnight, somewhere in your early 50s, and has been stubbornly resistant to everything you have tried since. The belly that was not there before, the midsection that does not respond the way the rest of your body does to diet and exercise, the waistband that keeps getting a little tighter no matter how careful you are. And here is what makes it particularly frustrating. You are not eating dramatically differently than you used to. You are not completely sedentary. And yet this specific fat, right in the middle of your body, refuses to move. If that experience resonates with you, today's video is going to explain something important, something that goes much deeper than appearances or clothing sizes. Because this particular fat, the kind that accumulates in and around the abdomen after 50, is not just a cosmetic concern. It is a metabolic one. And understanding the connection between deep belly fat and blood sugar may be the most clarifying thing you hear about your health this year. Take Margaret, for example. She is 62 years old, lives in suburban Florida, and has been managing pre-diabetes with metformin for the past 2 years. Margaret had always been fairly active and watched what she ate. But after 50, a persistent belly seemed to appear almost from nowhere. Her doctor mentioned visceral fat at her last checkup. Her blood sugar readings had been creeping upward, and no matter how many walks she took or how carefully she ate, the middle would not budge. When Margaret began understanding the insulin resistance connection and addressing it from the inside out, her readings started improving, and the waistline slowly began to follow. The two, it turned out, were the same problem. Before we get into the mechanics of what is happening, let us establish something important. Not all belly fat is the same, and understanding the difference between the two main types changes everything about how you approach it. The fat you can pinch between your fingers, the soft layer just beneath the skin, is called subcutaneous fat. The fat we are talking about today is different. It is called visceral fat, and it sits deeper in the body, packed around your internal organs, around the liver, the pancreas, the intestines, the kidneys. This is one of the primary mechanisms by which visceral fat drives insulin resistance. The liver, compromised by the inflammatory environment created by surrounding fat, loses its ability to respond to insulin precisely. And when the liver stops responding to insulin properly, blood sugar regulation across the entire body becomes less stable. This is why adults who develop noticeable belly fat after 50 often find their blood sugar readings creeping upward at the same time. Many adults tell me they feel more in control when they can see the pattern written out clearly. So I created a simple, one-page protocol you can print and follow quietly at home. Hormonal shifts are the most significant driver. In women, the decline of estrogen during and after menopause changes where the body preferentially stores fat. Before menopause, estrogen tends to direct fat storage toward the hips and thighs. After menopause, without estrogen's directional influence, fat storage shifts toward the abdomen, and specifically toward visceral deposits around the organs. In men, declining testosterone after 50 reduces muscle mass and increases fat storage. And as with women, the body's preferred storage location shifts toward the abdominal region. Lower testosterone is directly associated with increased visceral fat accumulation and worsened insulin resistance in men. The loss of muscle mass that accompanies aging, a process called sarcopenia that accelerates after 50, further contributes to the problem. Muscle tissue is one of the body's primary sites of glucose disposal. It absorbs glucose from the bloodstream efficiently, particularly during movement. As muscle mass declines, the body's capacity to clear glucose after meals decreases. Insulin levels stay elevated, and elevated insulin, as we have just discussed, promotes visceral fat storage. Cortisol, the body's stress hormone, also plays a meaningful role. Cortisol specifically promotes visceral fat storage, and cortisol dysregulation, which becomes more common with age, poor sleep, and chronic stress, creates a hormonal environment that is particularly conducive to accumulating the deep abdominal fat we are discussing today. So what can you do about it? Let us talk about the foundations that move the needle most meaningfully. The most impactful thing you can do for visceral fat reduction is build and preserve muscle mass. And while cardiovascular movement and mindful eating both matter, resistance training has a uniquely powerful effect on the specific problem of visceral fat and insulin resistance. When you challenge your muscles with resistance, whether through body weight exercises, resistance bands, light free weights, or gym equipment, several things happen. Your muscles become more sensitive to insulin. They develop a greater capacity to absorb and use glucose. Your resting metabolic rate increases as muscle mass grows. And the hormonal environment in your body shifts in ways that specifically disfavor visceral fat storage. Research consistently shows that resistance training produces greater reductions in visceral fat and greater improvements in insulin sensitivity than cardiovascular exercise alone at equivalent time investments. For adults over 50 dealing with insulin resistance belly, this finding is significant. 2 to 3 sessions of resistance training per week, even at a modest and appropriate intensity, make a measurable and meaningful difference over time. This does not need to be intimidating or intense. Chair exercises and wall push-ups. Resistance band work in the living room. Light dumbbells a few times a week. The specific activity matters less than the principle of challenging the muscles progressively and consistently. Protein intake supports muscle preservation and growth. Adequate daily protein, distributed across meals rather than concentrated in one sitting, gives your muscles the raw material they need to maintain themselves and respond to exercise. It also supports blood sugar stability by moderating the glucose response at every meal, which helps reduce the insulin spikes that promote visceral fat storage. Sleep is a non-negotiable foundation here. Growth hormone, which is released primarily during deep sleep, plays a direct role in fat metabolism and muscle maintenance. Cortisol regulation, which is essential for preventing the stress-driven visceral fat accumulation we discussed, depends on adequate and restorative sleep. Adults who consistently sleep fewer than 7 hours show measurably higher visceral fat accumulation and worse insulin sensitivity than those who protect their sleep. This is not a minor factor, it is central. Stress management matters for the same cortisol-related reasons. Chronic stress does not just feel bad. It creates a hormonal environment that is biologically conducive to visceral fat accumulation. Gentle daily practices that lower cortisol, whether movement, time in nature, breathing exercises, or consistent social connection, are not soft additions to a health plan. They are targeted metabolic interventions. Dietary approaches that reduce the insulin spikes driving the cycle are also important. Meals built around protein, fiber, and healthy fat, with moderate and complex rather than refined carbohydrates, produce lower post-meal insulin responses. Lower insulin responses mean less visceral fat storage signaling. Over time, consistently moderate insulin levels create an environment in which the body can begin drawing on visceral fat stores, rather than continually adding to them. Even the best dietary and lifestyle efforts work against a cellular environment that is less equipped to respond. Berberine has been studied extensively for its role in supporting healthy glucose metabolism and improving insulin sensitivity through cellular pathways that directly address the mechanisms driving insulin resistance. Chromium supports the function of insulin receptors, helping glucose enter the cells more efficiently and reducing the insulin demand that promotes visceral fat storage. Magnesium supports insulin signaling, modulates inflammation, and promotes the quality of sleep that is essential for the hormonal environment favorable to visceral fat reduction. Alpha-lipoic acid is a powerful antioxidant that supports mitochondrial function and helps protect cells from the oxidative stress associated with insulin resistance and elevated blood sugar. Vitamin D, which functions as a hormone as much as a vitamin, plays a direct role in insulin sensitivity and is commonly deficient in adults over 50. B vitamins support the metabolic pathways involved in glucose processing and cellular energy production at every meal. Other nutrients like gymnema and eleuthero can further aid glucose uptake and adaptation, enhancing how your body responds to the insulin signaling challenges that drive the accumulation of deep belly fat and the blood sugar instability that accompanies it. Because obtaining meaningful amounts of all of these nutrients through food alone becomes increasingly difficult after 50, many adults find that a well-formulated, comprehensive daily supplement that brings these key nutrients together in one convenient approach provides the cellular foundation their lifestyle changes need to produce their best results. For those in similar situations, if you would like to explore what that kind of comprehensive nutritional support looks like, and what others managing insulin resistance and belly fat in their 50s and 60s have found helpful, there is a resource in the description below where you can learn more at your own pace. Before we close, the important reminder: this video is for educational purposes only and is not medical advice. It is not intended to diagnose, treat, or cure any health condition. Abdominal fat accumulation and blood sugar concerns can have multiple contributing causes, some of which benefit from direct medical evaluation. Please speak with your healthcare provider about your individual situation, particularly if you are currently managing blood sugar concerns, taking related medications, or experiencing other symptoms that concern you. Here's what I want you to carry forward from today. The belly that arrived after 50 and refuses to budge is not simply a cosmetic frustration. It is a metabolic signal. A signal that visceral fat is accumulating around your organs, driving inflammation, compromising your liver's ability to regulate glucose, worsening insulin resistance, and creating a cycle that affects how you feel every single day. But it is also a cycle that responds to resistance training that rebuilds the muscle mass your metabolism depends on, to protein and fiber that moderate the insulin spikes driving visceral fat storage, to sleep that restores the hormonal environment your body needs, to stress management that keeps cortisol from working against you, and to the nutritional foundations that equip your cells to participate fully in the process of change. Margaret's readings improved. Her waistline began to follow, not through dramatic measures or extreme effort, through understanding the connection and addressing it consistently, one small step at a time. That is available to you as well, at any age, starting today. Thank you for spending this time with TrueWell Prime. Take good care of yourself.